A hopeful two-day meeting between provincial health ministers and their federal counterpart came to a disappointing end yesterday. The federal government has withdrawn from a joint communique on health funding with provincial and territorial ministers. Now, this ended 2 days of widely anticipated meetings in Vancouver without any agreement. Federal Health Minister Jean-Yves Duclos blames the premiers for releasing a statement that he says depicted the talks as a failure. Now, he says this forced their ministers, quote, to think of one thing and one thing only: money. BC Health Minister Adrian Dix made it clear that he and other provincial and territorial health ministers were united behind a request for federal funding to be increased from 22 to 35%. Now, meanwhile, healthcare systems across the country are dealing with issues including staff shortages, overwhelmed hospitals, mental health issues, and new virus variants. Well, joining us now to give us his perspective amid all of this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to be here.
So, what is your take on the health minister's meetings with Federal Health Minister Duclos?
Well, I think we had a golden opportunity for the federal and provincial health ministers to really look and advocate for Canadian healthcare and even help the 1.3 million healthcare workers from coast to coast. I think we were hoping this meeting could really chart a clear path to a tangible action plan and help rebuild some of the struggling healthcare systems that we've been having. Unfortunately, it didn't get to where we wanted. There are some positives for it, though. I think the health ministers definitely understood the issues, and sometimes in politics, that is the biggest problem. So at least everyone is on the same page in terms of priorities and concerns we're facing. Remember, this is also the first meeting they've had since 2018 in person. So is there a lot more work to be done? Absolutely. Is it going to be solved in 2 days at a conference room in the Pan Pacific Hotel? Probably not.
Now, on a personal note, how are you, your colleagues, your employees faring in what some health ministers are currently calling a crumbling healthcare system, Dr. Raut?
Well, to me, I would have to agree with my colleagues at the Canadian Medical Association and the Canadian Nursing Association that it's very clear that Canada's health system is not really working the way it should. We're seeing doctor and nursing shortages, and the healthcare crisis is having very detrimental consequences to our system. And people are losing confidence when they are concerned that they may not be able to access those critical health services. I think now what we have to do is really focus on that communication and coordinated piece to really overcome those challenges that we have.
Now, as we mentioned, there is no shortage of issues hitting the Canadian healthcare system, Dr. Raut. So, what has been your primary concern amid all of this? What's been hitting you the hardest right now?
My primary concern here is really about our patients. I think it's very clear to everyone, even at the conference, that Canadian patients and caregivers are really continuing to suffer. So we're having healthcare providers who are burning out and leaving their professions. We're seeing wait lists that are growing rapidly. Emergency departments are closing due to staff shortages. So I think we're all deeply concerned about what that means for Canadian healthcare, but also for the average Canadian who's a patient and a caregiver as well.
Deeply concerned indeed, Dr. Raut. Now, we mentioned health ministers are asking for an increase to the Canada Health Transfer benefit. So, can you tell us a little bit more how that would benefit your own practice, your staff, and your patients?
Yeah, it's a difficult question. I have a bit of background in health systems, so when I look at this situation, I think the health transfers would be a good start, but I don't think it would necessarily fix all of these problems, even if the transfers went to 100%. I mean, these are structural issues that we've got to focus on: health system strengthening and accountability. Accountability meaning federal, provincial, territorial accountability, physician accountability, and patient accountability. So I think there's a big conversation here that we have to look at what the future of healthcare is going to be in Canada.
Right, Dr. Raut, just about a minute left here, but what's at risk here if the federal government does not take action on these supports?
Yeah, I think what we're going to see is if we don't really work together on this, everyone is going to suffer, especially the most vulnerable, our patients and caregivers. We're talking about serious system health challenges here that healthcare providers and organizations are continuing to have. We're going to need both short-term and long-term solutions here to really make a difference. And I think the Canadian Medical Association, the Canadian Nursing Association, and Healthcare Can have come up with a great policy piece called A Prescription for Hope, which is definitely worth checking out, which would look at some of those solutions there as well.
Prescription for Hope. Definitely have to take a look at that. Dr. Raut, thank you again for joining us today on Forum Daily.
Thanks so much for having me.
All right, stay with us. We'll be right back after the break. And when we return, we're going to be taking a look at a big move in the crypto world with the Binance FTX merger. Now, this move is just the latest example of just how quickly fortunes can change in the rapidly evolving space. We'll be speaking with Bobby Del Rio, host of the Daily Drop, which focuses on cryptocurrencies. So, a very interesting interview coming up next. Stay with us.